I'm here with PA Lynn Szabo of Redwood Urgent Care. This is our first ever Health Matters. It is hopefully will be a weekly segment on community service and just checking in with Lynn and getting sort of taking the pulse of the community health-wise. Today's topic, immunizations. So that's a big, big topic across the country. There's a whole bunch of, social media is just rife with information and misinformation. What's your take as a healthcare provider on just blanket across the board immunizing your child?
Well, I'm pro-immunization, but I have some concerns because I think there's a lot of misinformation, like you alluded to, and it's causing patient or parents to decrease the amount of immunizations they're giving their kids. And we're in Del Norte County, we're still doing pretty well. But counties near us have starting to have problems. There's a real concern about the measles epidemic that started in Washington. If it moved down the I-5 corridor, which would be really easy, and then went to the coast, we would be in good shape. Humboldt County, not so much in good shape. Mm-hmm. Oregon might also have some problems too. So it seemed like a reasonable topic. So when in preparation for this talk, I went online to find out about the schools locally in Del Norte County and the immunization rates of each school. You can actually find that out. I was kind of pleasantly surprised to see that. And the lowest percentage rate of immunization is a school with 91% of their students immunized, and the highest is 99%, with most schools in Del Norte County being between 95 and 99% immunized.
Now, you had mentioned, I'm sorry, before we started recording that below 91% herd immunity starts to break down.
Right.
What does that mean? People, you hear herd immunity a whole bunch, but what does that mean for somebody, for somebody going to school where you've got fewer kids immunized?
So herd immunity is referenced mostly to kids that can't get immunizations, and that one thing that their healthcare providers recommend is that they protect the people around them so the rest of the herd is healthy and it can protect the one that can't be immunized. So some people kind of selectively change that a little bit and count on other people's immunizations keeping their personal kids from getting diseases, and that's what we mean when we talk about herd immunity. The problem is, depending on the disease, herd immunity is between 81% and 91% of the rest of the herd being immunized and therefore protected, and that will keep the vulnerable part of the population protected. But then the school that we have locally is at 91%, and I was kind of surprised. And if you move further south down into Humboldt County, there's schools that are in the upper 30s and low 40s.
That's remarkable.
And 60s. So it's a significant issue in Humboldt County.
Mm-hmm, mm-hmm.
So.
Now, have you researched reasons for parents' refusal of vaccinations? I mean, the biggest one, of course, everybody knows about is the supposed connection between immunizations and autism.
Yeah.
Is that a thing?
Yeah, it's not a thing, actually.
Yeah.
There is no the correspondence between the MMR vaccine, which is the specific one of concern. But there's, in general, parents have 4 different areas where they're concerned. Some parents refuse immunization on religious grounds, and an example of that might be an Amish community. And really, nobody's going to change their mind. That's their spiritual belief, and it's deeply held. And the next group that has a problem and objection to immunizations is a group that's concerned about their safety, and that's where the MMR thing comes in. And that is influenced heavily by social media. And some of the things that we see on Facebook or that we talk to our friends about are kind of wrong. And it's hard for parents, I think, to talk to their physicians and maybe get more credible information. I also think that in this kind of age of news bites that we read the headlines and we go on, and you can see a sensationalized headline and kind of think that's truthful, but not without really looking at the deeper issue, which is important to do. Some other things about immunizations, sometimes people just have personal beliefs that they think an unimmunized child is actually going to be healthier, and then they'll be healthier if they get the disease. The problem there is that they're underestimating the risk of the disease. And some of these diseases may not cause widespread problems with mortality and morbidity or death and dysfunction, but sometimes there can be a very serious consequence of being unimmunized and having to go through the disease. And I think that parents shouldn't underestimate that.
Now, correct me if I'm wrong, but being immunized, isn't that the idea behind immunization, is that you get the benefits of having the disease without actually having the disease?
Right, but there's some argument that immunizations give like a lowered sense of immunity, so a little bit of protection, but not full protection.
Gotcha.
That the disease would give.
And that's not the case, because you develop the antibodies and...
Right.
Yeah.
Some vaccines, of course, are more efficient at that than others.
Mhm.
I guess you could say better at that, but still, depending on the disease and the time schedule that somebody is immunized, all those factors are kind of like modifiable.
Mhm.
But most parents don't buy into immunizations because they really don't know what to do. They don't know where to get information. They don't really understand it. What they're reading on social media is really terrifying, and they don't. I would say in the age of healthcare providers not really having adequate time to connect with people and to talk to them, it really boils down to a big lack of communication for the majority of people who choose not to immunize. They're not really not immunizing, they're postponing, but they're not postponing in any kind of definite way. They're postponing indefinitely.
Just keep putting it off and putting it
Right.
off. So we mentioned the supposed, and it's been what, a decade now, more? How long has the MMR and autism debate been going on?
Oh, I think it's been going on since before 2002.
Okay.
There's original research from Denmark where they looked at over 500,000 children in Denmark, and they compared children that got autism with their both immunized and not immunized, and they really found no connection with 95% certainty.
Mhm.
And then they recently kind of redid that study with over 650,000 children, and they looked at it in a slightly different way. They looked at it comparing the unimmunized rates of autism in unimmunized children versus immunized children, and they found no connection. But they also looked at children who had siblings who were autistic and therefore thought to be at higher risk for being autistic, to see if the MMR predisposed them
To sort of genetically express something
right,
that was
in
there?
a child that was already known to be sensitive, and they didn't find any
Nothing
data
there.
that supported it. Nothing. There is no connection. I think the original physician who wrote the paper has been quite disgraced.
And debunked
Yeah.
with...
yeah, that one's done.
Yeah.
No connection.
Are there any other legitimate people who have talked about mercury in immunizations? Are there any other safety concerns that are real?
Well, the concern about mercury is for over 10 years now, there's no mercury in any of the vaccines that we give to children under age 6.
Okay.
There's also a concern about formaldehyde, and I thought this was an interesting statistic. The amount of formaldehyde in a vaccine, it truly is there, but is less than what we naturally have in our bloodstream.
Wait a minute. This is a sidebar. I have formaldehyde in my bloodstream? Just naturally
just
occur?
a teeny bit.
Okay.
Just from cellular byproducts.
Okay, all right. Because it's
So-
used in immunization. It's a preservative, right? Isn't that what formaldehyde is used as?
Exactly. And the reason it's in there is to keep bacteria from growing. So you don't want to inject a child with bacteria.
Yeah, yeah.
So the formaldehyde is definitely less risk, but it's kind of a buzzword, and it could make for a sensationalized story, I think.
So you mentioned the fueling a lot of this controversy is a breakdown in communication between healthcare providers and parents. What do you as a healthcare provider do if you're confronted with somebody who comes through and says that they don't immunize their child? I guess, what do you do, and what is your responsibility?
Well, I'm in urgent care, so we talk mostly about tetanus shots.
Yeah.
I do think that sometimes people don't admit that their child isn't immunized, and I think it's because that they've discussed it before and they've been put down as ignorant, and I think that's really wrong of us as medical providers. I think that that parents should be truthful for the decisions that they've made for their child, because it affects how we approach a child as far as the care. But the second thing is, I think providers have to take the opportunity to put the computer down, to fold their hands and just listen to what the patient's saying. Because at that point, if you can be, if you can answer the questions honestly, if you can point them to resources that are helpful, if you can say what are your concerns and directly kind of address them in just a person-to-person, not hierarchical, not condescending way, then I think we could get through that majority of parents that are just confused.
Mhm. Because underlying their confusion with this specific issue is legitimate, like caring for the well-being of their child.
Right.
Yeah.
And then I think it's really important, and I haven't seen any of this in the literature, but I think there should be a plan B. Let's say, I have a 7-year-old boy who steps on a nail and he's unimmunized. Then at that point, the medical recommendations to protect that child from tetanus are way more risky and involve, for example, tetanus immunoglobulin, which is a human blood product. And as far as the risk to that child's health and you can imagine a rambunctious 7-year-old child running in the backyard in the summer by the chicken coop with no shoes on, boom, it happens. And it happens almost to every kid.
Mm-hmm.
And at that point, the decisions that need to be made are way riskier, and that the threat to the child's life is way riskier than it would be from any actual risk from the vaccine. So I wish people would get a plan B. I wish they would build the herd immunity around the child that they don't want to vaccinate. I wish that they would see, what the consequences of not vaccinating and be kind of prepared. So if there's measles in an unimmunized child's school, does that mean you send your child to school with this highly contagious disease that the child's vulnerable to? Or does that mean that maybe they have to go to grandmother's house for like 3 months and do some homeschooling? You got to be prepared to take the next step depending on what decision you make with your child's health.
I think a lot of these diseases we've become complacent about because they just
Right.
haven't been a thing in our culture for
Right.
the better part of a century, right?
Yeah,
I
and
mean,
a lot of providers have never even seen kids with these diseases, and a lot of us don't even know anybody who's been really affected by them or has actually died from them.
Mhm.
But it still happens. It's still real, and the risk of the disease, it really bears saying the risk of the disease is much, much, much higher than any possible risk of immunization.
Tell me about the app from Children's Hospital of Philadelphia.
Oh, this was so cool. I found this today. One of my medical assistants, Diana Madrano, told me that they use it commonly at Open Door. It is a free app. You can download it to a smartphone, and I imagine an Android, but I was working with it on my phone. And it's intuitive to go around the app. The words are reasonable for the average lay person to understand. It has very clear information about what the risks are, what the disease, how it protects, what the recommendations for immunization, what the immunization schedule is. It even has little videos that play, and she was able to find a game. It had a game, a crossword puzzle, no hangman, on relating to vaccines. And I really would encourage people. It was quite a helpful thing. I have it on my phone now. I'm sure I'm going to use it in my practice. But as a parent, and I remember when my children were little and I was making the decision to vaccinate, this would have been really helpful information to me. Because even though I'm a healthcare provider, being a mom of a young child, that's a whole different world to be in. And this kind of information at my fingertips would have been invaluable.
Wow. What's the name of the app?
It is, let's see, Vaccines on the Go.
And it's just information. You can just get on and find out what
I
you need
just
to know.
went to my app store, went for Vaccines on the Go. It's created by Children's Hospital of Philadelphia. It lists all the individual vaccines, what's actually in the vial, what's the schedule, and what are the educational videos. They also suggest kind of modified schedules for people who want to kind of like draw the immunizations out, even though the body can totally handle 5 shots at a time.
Mm-hmm.
And when your arm gets red and swollen, we don't see that as a bad thing. We see that as a good immune response.
Oh, good point. Yeah.
So that's not really a bad side effect to us. That's what we expected to see, and we're happy to see it's happening.
It's what's supposed to happen.
So Vaccines on the Go was a great. I would encourage any parent to take a look at it.
Excellent. What is your challenge to providers and parents?
My challenge is that they should sit down and talk without just have a common discussion. Realize they're both on the same side. Really, we want good health for children, and we have to talk to each other without condensation, without hierarchy. We have to answer questions honestly as far as medical people, and I would say the same for parents. If they have concerns and they don't necessarily want to do something the way that's recommended, then, maybe they should let us know how they're going to, what they're deciding to do, so that we can be aware of what's going on with the child, and we can also contribute to the best care of that precious, precious kid.
Could somebody stop in here and ask you a question? If
Totally. I'll show you my app. It's really great. Yeah, anytime. We're here to help with education of the community at any opportunity.
Excellent. Lynn, is there anything else that we haven't covered and you haven't gotten to say that I didn't ask that you want to get in?
Not that I can think of, but I really appreciate this conversation. It's such a timely topic.
Excellent. Thank you very much.
Okay.